Ladies and gentlemen, welcome to today's video. My name is Dr. Aurangzeb and I am consultant cardiologist working at Severity Teaching Hospital in Swat. Today we are going to discuss CURB-65 score, a clinical score used to assess the severity of pneumonia and to formulate and recommend a management plan for these patients. If you are new to my channel, I will request you to please subscribe to this channel and share this video. The important components of the CURB-65 score are confusion, urea, respiratory rate, blood pressure, and age more than 65 years. Confusion can be defined as a mental state score of 8 or less or new disorientation in time, place, and person. Uremia is defined as blood urea nitrogen of more than 20 mg per deciliter. The third parameter is respiratory rate, and if it is more than 30 per minute, it is significant. Blood pressure if it is low. Systolic blood pressure less than 90 mm of mercury and or diastolic blood pressure of less than 60 mm of mercury. And finally, age more than 65 years. Remember that each component has a score of 1 and a maximum score of 5 can be obtained. Based on the final score, these patients can be divided into 3 subcategories. The first category are patients with score of 0 to 1. It means that these patients have a low risk and they can be treated as outpatient on OPD basis. The second group are patients with moderate to severe pneumonia. They have a score of 2. It means that they need short inpatient hospitalization or closely supervised outpatient treatment. Score of 3 to 5 means severe pneumonia, hospitalization is required, and in some cases ICU care may be considered. Thank you so much for your attention, and I will request you to please subscribe to the channel.